Chris Smith. Well, how could this work in practice? Sarah Robinson is a clinical director of surgery and a consultant surgeon herself at Northumbria Healthcare NHS Foundation Trust. The trust introduced 7-day services 10 years ago. So what did that involve?
Hello there. Essentially, it's involved a multidisciplinary approach, really. It's not purely the consultants. Your other guest is correct in that you do need your other services to be available, such as physios, OTs, hospital to home. But I do think it's essential that consultants are present and are available. We're dealing with an increasingly complicated patient cohort, increasingly elderly with multiple comorbidities. And particularly for a surgeon, it's highly valuable to have the help of consultant cardiologists, respiratory physicians, intensivists available before we do, for example, emergency laparotomy, to optimise that patient and give them the best chance of success.
But was it possible to do that without increasing the number of consultants? Because that was the point that Chris Smith was making, that, you know, in an ideal world, yes, but you'd need more budgets to be able to do it.
Well, we opened our emergency hospital 5 weeks ago, and we've managed to do it without expanding our surgical consultant workforce. And we have expanded some of the other services, such as the input we have at a more junior level, but we haven't needed so far to expand our consultant numbers. We've just altered the rotas and been a little bit more accepting of the fact that our weekday working is a little different.
And what about support staff?
We are absolutely dependent on the ancillary staff, physios, for example, post-operatively for mobilising, chest physio to reduce chest infections, the OTs to get people mobilised quickly and assess what they need to have to allow them to get home and helping themselves, and also helping the family. And the hospital home team are very important in that as well. So, yes, they're absolutely vital to make this work.
And were you able to do this with the consent of the consultants? Did you meet much resistance?
Minimal resistance, to be honest. I think as a trust we've taken on board that emergency care is incredibly important and there's an increasing pressure on it. And so for many, many years now, that's been the focus of how we develop our service. So, yes, there have been concerns. Hopefully most of those have been addressed. And in fact, the feedback we're getting from most of our consultant teams that have been at the emergency hospital is it's actually a fun and very satisfying, fulfilling place to work.
And just briefly, did it cost you more money?
Not from a consultant point of view, not at all.
Sarah Robinson, many thanks for joining us. The former most senior judge in England and Wales has told this programme that the quality and speed of justice will be affected for the worse by financial cuts. Lord Judge says that the Ministry of Justice budget should be protected in the same way that the Health Department is. In a wide-ranging interview, Lord Judge also discussed his new role as Chief Surveillance Commissioner and called for a new law to deal with the changing world of technology. But we began by discussing today's crime figures. The latest from the survey for England and Wales show a 7% fall, with the lowest estimate since it began in 1981. The other measure, police recorded crime, showed a rise, but it's thought that this may reflect changes in recording practices rather than a rise in violent crime.
Always beware of statistics. They can be very easily misused. I think there is a fear of crime. I think